Hello everybody, this is Michael McEvoy. We're going to really get into an interesting video here called Heart Disease and Cholesterol Myths, 7 Major Blood Tests and Powerful Nutrition. This is going to be a very fascinating video presentation. It's going to be very quick, but we're going to get into some major blood chemistry factors that don't get a lot of press but are critically important if you have a cardiovascular disease risk in your family or if you even suffer from heart disease now. So let's get into the myth of cholesterol. There's a major problems with the cholesterol causes heart disease hypothesis. So first of all, we have to understand that cholesterol is an essential nutrient. It is essential for life processes, and it's also a very important anti-inflammatory. So many people don't realize that cholesterol serves many essential roles in the body. Number one, it is the main lipid found in all the cell membranes of the body. Cholesterol is also essential for every steroid hormone, including the sex and adrenal hormones, testosterone, cortisol, DHEA, progesterone, estrogen. Cholesterol is also a powerful anti-inflammatory, and that means that when you have damage that's taking place in the body because of inflammation, your body produces more cholesterol, sends it out to those places of inflammation to put out the fire. You could think of cholesterol as the water that's being used to put out a burning house. So if you see elevations in cholesterol, the last thing you're going to want to do is to try to lower it. The first thing you're going to want to do is to find out where the inflammation is actually coming from. Okay, so next is that heart disease can actually feature normal, low, or high total cholesterol. And that means that the total cholesterol is not very correlative as to your cardiovascular risk. So just because a blood test says you have high total cholesterol, well, first of all, high according to whom? Based on what? So the conventional medical association in their ridiculous assertion that every man, woman, and child should have a total cholesterol less than 200, this is absurd. And not only is it absurd, but it also doesn't take into account the reality that heart disease develops with people with all types of cholesterol levels. So the other discussion here that's worth talking about is the LDL, the so-called bad cholesterol that is supposedly bad because it can oxidize. It can oxidize and it can cause plaque to form in the arteries. And this is true. Oxidized LDL can cause plaque to form, but it's very important to make the distinction that oxidized LDL is not the same as your total LDL. That means theoretically you can actually have a low LDL level but a high level of oxidized LDL. So it's actually more important to talk about the quality of the LDL particle than the quantity of it. This is a very critical point that gets overlooked. So in one of the more critical points here with this slide is that efforts to actually lower your cholesterol level through statin drugs or even through nutritional means are not effective at actually improving the outcome of heart disease. And in many cases, the medications used to lower cholesterol, like statins, for example, have been shown in literature to increase the risk of heart failure, stroke, pancreas dysfunction, cataracts, neuropathy, and muscle atrophy. And a lot of this is because of the fact that cholesterol is so critical to the body. There's no such thing as good cholesterol. There's no such thing as bad cholesterol. That's just a very confusing way of looking at an issue that is a lot more complicated. And so what we're going to get into here are the real causes of cardiovascular disease, some of the major factors that are associated with them. So attempts to actually lower cholesterol levels to prevent heart disease, they often ignore the more important factors. And these are 3 major factors which we're going to look at. Genetic mutations, which predispose one towards heart disease, hyperinsulinism, which sets up the process of vascular disease, and inflammation, which drives the process of vascular disease. So cardiovascular disease is multifactorial. It has many different causes. And if you're not addressing all of the major causes, you're only treating the symptom, and you may actually be making the problem worse by treating the symptom. So the wrong diet for your own body and the nutritional deficiencies that the wrong diet can cause is a major cause of concern with heart disease. Toxicity is also a major cause of concern with heart disease, and there's been a lot of literature that have shown that heavy metal poisoning, like mercury from dental amalgam fillings to cadmium and lead poisoning, which are all toxic heavy metals, they all have a large role to play in increasing vascular damage to the arteries and the blood vessels. Also, lifestyle factors, sedentary lifestyle, lack of exercise, high levels of stress, alcohol consumption. These are factors that also can can increase your risk of cardiovascular disease, and certain genetic predispositions are a bigger factor when these three factors above are present. So just because we have gene predispositions or genetic mutations, it doesn't necessarily guarantee we're going to develop heart disease. This is critical to understand. Many people think, oh, I've got certain gene mutations, I'm screwed, there's nothing that I can do about it. That's false. And the last 10 years research on genetics and epigenetics has completely shifted the whole paradigm to realizing that the real factors that influence your diet, lifestyle, and toxicity, these are causing our gene mutations to be accelerated. So let's pay attention to 7 major blood tests that your doctor should be running but probably isn't, that your healthcare provider should be paying a lot more attention to but isn't, because they're so obsessed with cholesterol levels. And again, these are 7 critical factors that are really going to be major, including heart disease, diabetes, and the major killers of modern disease epidemics. So number 1, insulin, glucose, triglycerides, homocysteine, cardio-CRP, uric acid, and fibrinogen. These are 7 major blood chemistry factors that you should be running regularly if you think you have a heart disease risk. Okay, so let's go ahead and break down some of these essential blood chemistry factors, and we'll even talk about the ideal lab values that you should be using to understand what a high and low value is. So hormones secreted by the pancreas to lower blood sugar. Insulin is a very inflammatory hormone when it's elevated, and we want to see that the ideal range for insulin, if you're in US units, it's 1 to 5, so it's actually be very low. The laboratory reference ranges that you're looking at on the blood test report, it's erroneous. You can't use it because a person who has an insulin level that's in double digits, they're already a diabetic, they already have multiple health issues going on. So you have to use functional laboratory ideal values, not the reference ranges, which are just statistical averages. So it's also important to point out that high levels of insulin do result from elevated blood sugar. So when you eat high sugar foods, foods that are very refined in carbohydrates, your pancreas produces insulin. And this is a picture to the right here of your pancreas in the middle there, that organ, that orange organ. And so when insulin goes up, when it increases, it's highly inflammatory. Chronically elevated insulin is a major cause of diabetes type 2 as well as insulin resistance. And so we have to address the dietary factors, reducing sugar and refined carbohydrates from the diet, alcohol, all these things are going to drive up the insulin levels. Best ways to normalize insulin, eliminate the foods that are causing the insulin and the glucose levels to go up. We can also look at nutritional supplementation that helps to improve insulin sensitivity. These include chromium and vanadium and vitamin B6 as well as vitamin D and magnesium. So let's look at glucose next. In the glucose and insulin blood chemistry factors, they often go very closely together because they're related. Ideally, we want to see a glucose level between 80 and 90. If you're an SI, it's 4.4 to 5. And this is a fasting glucose level. So of course, the glucose is the sugar in the blood that it serves as a source of fuel for all of the cells of the body. We all need glucose, but of course we know that if the glucose gets too high, this is a major insult on vascular inflammation. It damages our blood vessels. It can cause neuropathy. It's obviously elevated glucose level will cause type 2 diabetes and insulin resistance. The diet is a primary influence on your glucose. Sugars, refined carbohydrates, and alcohol of all kinds will all raise your glucose levels. The best way to normalize your glucose is to eliminate foods that cause an increase in glucose. Other ways that we can lower our glucose levels are to get more exercise, because when we exercise, we burn glucose more. Cells can eliminate the excess in the blood. And then also we can reduce our glucose by reducing our stress levels, because adrenal stress hormones like cortisol all can raise glucose levels as well. We can supplement with nutrients that actually help to improve glucose utilization and insulin sensitivity. These include the nutrients chromium, vanadium, B6, vitamin D, magnesium, as well as lipoic acid. A lot of the same nutrients that help to increase our insulin utilization as well. And this is an example of insulin and glucose levels on a blood test. This person is a diabetic, and we see that the glucose level is 154. That's very high. But we see that the insulin level is 9.7. And if you look at the reference range for the insulin on the far right, that's the lab reference range for the insulin, 0 to 24.9. So that's erroneous. We can't use that reference range. The person has an insulin level of 9.7, so they're, quote, within the normal limits, but the glucose level is 154. The person's already a diabetic. Diabetes type 2 is caused by insulin resistance. So we know that we have to use an ideal functional range for insulin, and we like to use 1 to 5 instead of 0 to 25. Let's take a look at triglycerides as another major blood chemistry factor. Ideally, the triglycerides fasting on a U.S. blood test 60 to 100. In SI units, that's 0.68 to 1.1. So triglycerides are fats in the blood that they serve as a source of fuel for all the muscles of the body. All the muscles need to burn triglycerides. It's essential, including the most important muscle here with the image you're looking at. The heart is one of the most important muscles of the body, obviously. But high triglycerides are associated with obesity, metabolic syndrome, and heart disease. When we have an excess of triglycerides, this is also a pro-inflammatory situation. So many people think, well, I should stop eating fat. I should eat a low-fat diet, and that's going to lower my triglycerides. That's not necessarily true at all. In fact, a high sugar diet is likely going to cause an elevation in triglycerides more than normal dietary fats will. But the same can also be true about elevated levels of carbohydrates in the diet, refined carbohydrates, alcohol, fatty liver, liver dysfunction. These all can lead to elevations in triglycerides. If you consume trans fatty acids, which are artificial fats that you're getting from fast foods, hydrogenated oils, these are toxic fats that will definitely increase your triglycerides dramatically. And also, if you have inadequate exercise, this is going to raise your triglycerides as well. So the best ways to lower your triglycerides: remove the toxic diet, cut the sugar, cut the alcohol out of the diet, and increase your exercise, because all the muscles are going to burn triglycerides. All the muscles of the body, when you're exercising cardio or weight training, you're all going to get these triglyceride levels down. Supplementing with L-carnitine, essential fatty acids, garlic, pomegranate, niacin, lecithin, and chromium. These are all supplemental ways to help to reduce the triglycerides level. And this is an example of a blood test of somebody who has a very elevated triglycerides level of 206. Again, we want to see it between about 60 and 100. So this person's more than twice the normal. Okay, next I want to talk about homocysteine, and this is an important risk factor for cardiovascular disease. And ideally, we want to see a homocysteine level between 6 and 8. That's a U.S. blood test. If you're on a European or an SI unit blood test, it's 44 to 59. So elevated homocysteine is an inflammatory protein waste product that it increases blood vessel damage by increasing the production of these other inflammatory proteins such as MMP9 and MIP1A. And homocysteine is produced in the methylation pathway. Elevated homocysteine will increase insulin resistance, and this is especially true of the homocysteine thiolactone, which is produced when there's high levels of inflammation that's going on. If your homocysteine is elevated, it means you're not methylating properly. And you can read articles on my website, metabolichealing.com, about what methylation is. So there can actually be possible genetic links for elevated homocysteine levels, and these can actually be lowered if you have high homocysteine that are being caused by gene mutations such as MTHFR. We can lower the homocysteine through powerful individualized nutrition. So we can do this through increasing the intake of dark leafy green vegetables in the diet like kale and spinach and broccoli. They all have high levels of folate, which is important to lower the homocysteine. We could supplementally take methylfolate, which is a very important form of folate that you might not be able to make if you have that MTHFR gene mutation. We can also supplement with vitamin B12, vitamin B6, a special nutrient known as NAC or N-acetylcysteine, and also another nutrient known as betaine. These are all the major nutrients that are involved in helping to reduce the homocysteine, which is very inflammatory and is a major cause of blood vessel damage. So here's an example of a blood test and as well as a gene test. The same person here. So we see that this person has an elevated homocysteine of 26. Again, we want to see it between 6 and 8, so under 10. And this person is 2.5 times the normal value. And so incidentally, this person also has an MTHFR gene mutation. He has a plus mutation, it means it's a double mutation. It's double the trouble if you have a plus for this gene. So this is a hereditary cause of cardiovascular disease. This person has a tremendously increased need for dark green vegetables in the diet, as well as this person is going to need to support their methylation cycle by taking the 5-methylfolate. Let's look at another major blood chemistry factor that's highly associated with vascular inflammation, cardiovascular disease, cardio-CRP, C-reactive protein. And we want to see this value very low to 0, as low to 0 as possible. Ideally in U.S. units, that's 0 to 3. If you're an SI, it's 0 to 28.6. So the C-reactive protein is a major risk factor for heart disease as well as other inflammatory conditions. And we see that the CRP will elevate with increased inflammation of all kinds. It's an acute phase protein, so whenever you have inflammation or infection that's present, the CRP will typically go up. And there's some major risk factors that can cause an elevated CRP. So trans fats in the diet, which are artificial fats that you're eating from fast foods, and partially hydrogenated vegetable oils, which are carcinogenic and toxic. These are trans fats. These are going to increase the C-reactive protein by as much as 73%. Also, infections can increase the CRP level. Acute inflammation, elevations in glucose, all will raise the cardio-CRP. So we can lower the CRP nutritionally by getting our blood sugar and insulin levels down, getting control of our diet. Lowering our homocysteine level is going to lower the CRP. It's going to reduce those acute phase proteins, the CRP of which is one of them. Supplementally, with nutritional supplements, we can help to lower the CRP using proteolytic enzymes like serrapeptase. We can also use special herbs like turmeric, ginger, and boswellia to do this as well. So you've got to get the C-reactive protein down as close to zero as possible. And this is an example of a blood test of somebody with a very high C-reactive protein, almost 2.5 times the high limit on the blood test. Another major risk factor for cardiovascular disease, something that shows up a lot with the clinical presentation of heart disease, is an elevation in uric acid. So we want to see on a U.S. blood test 3.5 to 5.0. Typically, heart disease patients, 75% of them have elevations in the uric acid. And it's important to point out that high uric acid reduces nitric oxide. And nitric oxide is a critical molecule for the heart and for the blood vessels. It dilates the blood vessels. It prevents the blood vessels from closing up, which is called occlusion. And so if we don't make enough nitric oxide because we have high uric acid, this is a major inflammatory risk factor. Uric acid is primarily increased by inflammation as well as infections, consumption of fructose. And this is some major research that's come out in the last few years that has shown that high fructose corn syrup from soda pop and from excess fruit sugar and fruit juice, this is a major reason why the uric acid level goes up. It's been typically thought that high purine foods like red meat and organ meats are the cause of elevations in uric acid. And this is actually more of a myth. From my clinical experience, this is not true. So what we want to be aware of is that fruit and sugar in general, fruit sugar is going to be the major cause here of elevations in uric acid. So we have to get the uric acid levels down, ideally between 3.5 and 5, or if you're in SI units, it's 208 to 297. Okay, and this is an example of an elevated uric acid level on a blood test. Again, we want to see it under 5. This person's at 8.8. Okay, and last but not least, fibrinogen. And we want to see ideally this blood test between 160 and 300, and that's in milligrams per deciliter. Fibrinogen, also known as fibrin, it's a major blood clotting protein. When there's high levels of fibrin that accumulate, there's a lot of blood coagulation, and this is due to inflammation. So when there's blood vessel damage happening in the arteries, for example, or in the blood vessels, the liver produces more fibrin, and it sends it out to basically is a repair mechanism. It's like a Band-Aid. But if we have too many Band-Aids that are building up in the arteries, we have elevated blood viscosity. The blood doesn't flow. It's very viscous. We have blood sludge. So we have to lower the fibrinogen nutritionally. So getting the inflammation down is essential, and we've talked a lot about ways to do that. Getting the sugar, glucose, insulin down. That's critical. Getting the homocysteine down, C-reactive protein down. Fibrinogen is going to come down when all of those inflammatory markers come down as well. We can also help to reduce our fibrinogen by eating more raw foods, which are rich with food enzymes. And enzymes help to reduce our overall inflammation. And so we can also supplement nutritionally with proteolytic enzyme supplements such as serrapeptase and nattokinase. When you take these special enzymes on an empty stomach, they have what's called fibrinolytic activity. They reduce the excess accumulation of blood fibrin, helping the blood to flow more cleanly. So realize that the blood of your body is like the river of life, right? It has to flow. The blood has to flow like a river in order for you to be healthy. But if you're toxic, if you eat a junk food diet, if you eat high sugar and trans fats and processed foods, your blood is going to look more like a swamp. It's going to be obstructed and it's going to be obscured and it's going to be toxic. We need to clear up the blood, clear up the body, clear up the diet. This is an example of a slightly elevated fibrinogen level in somebody with a cardiovascular disease risk profile. Okay, so use your nutrition as your medicine. Use a whole food organic diet. And the foods that you need to be consuming, they're going to vary from person to person. So it's essential to know what your metabolic type is. Your metabolic type is going to give you an insight into what your diet should look like. Should I be eating more protein and fat with my diet, which is very true for some people, or am I going to need to be eating higher plant food-based diet and lower amounts of protein and fat? And really, there's no one way of doing it, folks. From my clinical experience, the type of diet that each person needs to be consuming is extremely varied. So all those one-size-fits-all diet approaches that are out there in the nutrition world, I would really be very careful with them. Your diet has to be individualized to your own body. We can use high-quality nutritional supplements to help really get the inflammation down. We can improve our antioxidant status, which antagonize inflammation in the body, and they help to increase detoxification. These are powerful antioxidants like vitamin C, alpha-lipoic acid, coenzyme Q10, vitamin E, glutathione, and superoxide dismutase, or SOD. These are all very important antioxidants. So thanks so much for listening today. I hope this was useful information for you to help you take charge of your own health. Please subscribe to this channel by clicking the link below, and please also visit my website, www.metabolichealing.com, to learn more about my nutritional consulting services and educational products. Thank you for listening today. Best in health.